Good morning, guys. Welcome to Vitamin Infusions and Aesthetics. We're coming on to show you guys how to draw up your GPL1 medication prior to self-administration. In the kits that we've mailed out to you, you should have received a sharps container, of course, your GPL1 medication, alcohol pads, and several syringes. When removing your GPL1 from the refrigerator, you want to make sure you take your alcohol pad and clean the top of that GPL1 vial prior to each administration. You're going to take your insulin syringe and you're going to pop that orange cap off. On your insulin syringe, there are some important things you need to notice. There's the needle, and that's what you want to be very careful of. But inside that syringe, there is a plunger, and you can see me moving it up and down, which is black. That is going to be your mark for where you should stop when pulling your medication from the vial. The top of your plunger, which is here, is where you're going to stop when pulling your medication out. So you're going to take your sharps or your insulin syringe, you're going to take your vial, and you're going to flip your vial over. You want to make sure you have a good grip on your vial, a good grip on your syringe, and you're going to place your needle inside the vial, and you're going to withdraw your medication. It's okay to pull more than what is prescribed, but you do want to make sure you pay attention to your prescription to make sure you're actually administering the correct amount of medication. If you withdraw too much, you want to make sure you leave your needle inside the vial and then just push the remaining amount back into the vial itself. In this case, I am withdrawing 25 units of GPL1. So I'm going to push my plunger all the way up to the 25 mark. Okay. Once I've gotten the required or prescribed amount of medication into my syringe, I'm going to pull my vial off and I'm going to self-administer. If you're not ready to self-administer, we encourage you not to recap. But if you're not ready to administer your medication and you have to prep your insertion site, we ask that you place your top onto your table and take your needle and kind of scoop your lid back onto the syringe. That wasn't a great scoop, but that's what we recommend, other than you doing this, because you take the likelihood chance of sticking yourself. So again, if you're not ready to insert, we're going to scoop that cap back onto the syringe versus attempting to insert it while it's in your hand. Okay? Thank you guys for watching. Any questions, please post below.